The study that's been presented here today is the results of the 18-month results of a randomized trial of bosutinib versus imatinib for frontline therapy. And this is an important study because it's a pivotal study, and it follows a prior study that did the same comparison, and in that one the primary endpoint, which was complete cytogenetic response, was not met. Part of that was some toxicity, so the difference in this study is that there was a lower dose of bosutinib used, 400 milligrams instead of 500, and the primary endpoint was major molecular response at 12 months. So the results show that at 12 months the primary endpoint was met, meaning the rate of major molecular response was significantly higher compared to imatinib. In addition, there was also an improvement in the rate of complete cytogenetic response, so even that was met. There are fewer transformations. And the response at 3 months, this rate of BCR-ABL over ABL less than 10%, which we now know that it's a very important predictor of the long-term outcome, that was also significantly better compared to imatinib. So all of these important early markers of response are positive. That is very important because, as I mentioned, this is a pivotal trial, and this has been submitted to the FDA, and we expect an answer from the FDA regarding approval very soon. It's imminent. So if indeed it's approved, considering that the results are positive, we will have another option for these patients. And it's important because one of the things that this study shows also is that the safety profile is different for bosutinib compared to the other drugs. It does cause more diarrhea, but the diarrhea is early, it's very transient, it's very manageable. But it seems to have less of the cardiac events that we see with some of the other tyrosine kinase inhibitors. So that's particularly relevant for patients that have a lot of risk factors for arterial thrombotic events, myocardial infarctions, that kind of thing. So we'll have to see what the answer is from the FDA, and obviously we need to continue following this study to see the longer-term endpoints of event-free survival and overall survival. Again, this is the first look at the study, but it is very exciting, I think, to see another drug make it to this setting.